Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over how to care for a laceration. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So what is a laceration? So it refers to a skin wound without missing skin, okay? It's normally caused by a sharp object. Often it's blunt trauma, okay? So it does tear the skin. It's irregular in shape. They can be big, small, short, wide, just completely depends on what caused the laceration. Now, minor lacerations, they can be treated at home by just cleansing the wound, some soap and water, and bandaging it. They normally tack together quite easily. But then there are some deeper lacerations that may require stitches or staples. So if they're very deep, bleeding profusely, have jagged edges or exposed muscle or fat, you do want to have it checked out by a healthcare professional and possibly get some stitches. So can a laceration heal without stitches? So eventually it will close on its own. But there are times where stitches or staples are beneficial. Okay, it does heal a wound faster. It keeps it free from bacteria infection. It prevents scarring. It also helps reduce the risk of a lot of blood loss. So I'm sure we've all had those wounds where they're cut kind of deep, and every time we go to change out the bandage, it starts bleeding again for up to a week's time. Those are really the wounds that we should be getting just a little stitch in there for, to prevent the blood loss, to prevent further bacteria, infections, any other complications, okay? Now, sometimes lacerations can cause a toe or a finger to be severed. 100% these cannot heal on their own. They do need to be stitched up. So some steps to treating a laceration. So these are just general guidelines. So first we want to control the bleed. Okay, so we're going to apply firm pressure on the area for 15 minutes. This should be enough time to stop the bleed. If it is still bleeding after this time, we can use a tourniquet. Okay, so a tight band to stop blood flow. At this point, 911 should be called, emergency services, because we need that bleeding to stop, especially if it's like really, really bleeding. We need to prevent more blood loss, okay? Cleaning the wound. So say we got the wound to stop bleeding. We're then going to wash it with soap and warm water. At this point, the wound, it might start bleeding again. Okay, just get it cleaned up and then apply firm pressure on it for another 15 minutes. Get stitches if needed. Okay, if it is deep, you think you need stitches, you probably do. So once again, it lowers the risk of bacteria, infections, prevents scarring and bleeding. So if you do need stitches, go do that. You can also, if you're treating it at home, you can use an antiseptic. Now, I do not like peroxide or alcohol. I really don't even like polysporin, okay? There are some ingredients in it that a lot of people tend to have irritations to, and then the wound gets super irritated. It just causes the wound to be open longer. Healing times definitely slow down when you have inflammation like this. Okay, so what I suggest is povidone, iodine, or chlorhexidine. Okay, they both come in liquids. You can use them on the wound. They are the lowest tissue toxicity. Okay, so they when we're doing wound care, we don't want to cause toxicity to that wound because it slows down the healing process. Okay, so these two, povidone iodine and chlorhexidine, have the least amount of tissue toxicity. Okay. Also, if you haven't had a tetanus booster in the last 10 years, or you're unsure of your last tetanus booster, you should go get one. Because that is definitely a life-threatening complication. And with lacerations, we're always worried about that. So we want to make sure that we have a tetanus booster. Even if it is just a shallow wound, you should get a booster if needed. So that's all I have for this video, guys. I hope you did find it helpful, and you now know how to deal with a laceration at home and when you should go to the hospital. But that's all I have, and I hope to catch you in my next video. See you guys.